I'm not someone who got infected because I didn't know anything about HIV. When it first hit the headlines, I was working for a national newspaper, so there were lots of discussions. I also knew people who were being affected through the gay friends that I had. Before I went to Botswana to work, someone asked me if I was frightened of AIDS, and I said, why would I be frightened? Part of my work in Botswana was actually teaching young people about the virus and how to protect themselves. I was working as a teacher in a school in London. I decided to go back out to see my boyfriend in Botswana for the summer. I had had a HIV test as part of my medical when I'd come back from Africa, so I know exactly when I became infected, which is quite unusual, really. My boyfriend told me that he was negative because some months earlier he had given a blood transfusion to a relative. So it was fair enough for him to assume that he was negative because they'd taken his blood. But I suspect that his relative was also HIV positive, so the hospital thought it didn't really matter. It was actually in Angola that I was with my boyfriend when I fell ill, and then we were going to South Africa after that. And the doctor in South Africa just said, I'm very sorry, didn't expect to have to tell you this, but you're HIV positive. He suggested to go back to the UK. I saw a very good consultant. I thought that I wouldn't be able to go abroad again, but my consultant encouraged me to think about what I wanted to do with my life. One of the first things that had come into my head was, I'm not going to waste the rest of my life. I'm going to do something a bit meaningful with it. The thing I didn't put into the picture was that I didn't know that treatment was going to extend my life so much as it has. I applied for VSO in Cambodia. I had to choose my country very carefully because lots of countries don't allow you in without an HIV test. I ended up doing the most worthwhile, rewarding job of my life. Cambodia did teach me that I really wasn't healthy enough to be doing the sort of challenging job that I was doing, and so my health began to deteriorate and I had to leave. I could have come back to London, but I decided I would go to Edinburgh. I wasn't very well when I first came to Edinburgh. I didn't have any friends here and I really had no income. But what I did have was Waverley Care. I joined a fantastic women's group and we support each other. Now I'm healthy. I only need to visit the clinic every 6 months for checkups, and I'm in and out as fast as I can. I have had some bad experience too. I got a job, and during my probationary period, I revealed my status. A week later, they told me I didn't think I was just fitting into their community. I was devastated. I think I'd hoped that being honest would make them sympathetic and would improve my chances for a permanent contract. What a mistake. I think the most important people to be educated about HIV are those that think it could never happen to them. To those people, I would say it could.
HIV. It isn't going to go away if we ignore it. We all need to listen. What could you do to help?